Hello dear students, now let's learn about the various scores that are there to assess the severity of injury. The first one which came out was the abbreviated injury scale. Now this basically had 6 digits which gave us more information as to which part of the body was involved in that particular trauma or injury. Then they added a 7th digit to it, and this 7th digit was the severity. Now this was scored from 1 to 6, 1 being minimal severity and 6 being fatal. The next modification to this was the injury severity score. So what they did here is they took that 7th digit, that is the severity score, and they took 3 major organs that were involved and they squared that severity score. That's what is your injury severity score. Now the latest one that's being used is your revised trauma score. Now the revised trauma score takes into consideration the GCS, the systolic blood pressure and the respiratory rate. The easiest way to remember it is with this action. Okay, so GCS, the heart for the systolic blood pressure and the lungs on either side for the respiratory rate, and this is about the various scoring systems available to assess the severity of an injury. Thank you.